It is the initiative to change the current EMS and ER protocols so that our paramedics and doctors are allowed to use a patient's emergency medical orders for prompt and proper treatment. Currently, because of liability issues and actually a lot of the fear of the unknown and just that question in their mind of, do I know how to treat? It prohibits them, and they actually do have protocols that do prohibit them from using patient-carried meds. So when you have a rare disease, your medicine is rare, so it's not available. Most states, maybe 4 hospitals might carry specialty medications that a person needs. Those hospitals would be level 1 trauma centers, and that's the only ones that may have a doctor who would know about your condition. So right now, the issue is when an emergency happens and your paramedics show up and they take you to a local ER, they have no clue what to do. And so they just try to stabilize and transport. That means a helicopter trip to one of the large treatment centers. It means a delay in treatment. Most normally, air vac minimum is an hour and a half. And when you have a rare disease and you need specific treatment to save your life or to keep ongoing damage from happening, you don't have an hour and a half. So in 2 years' time, we've been researching this and working with, luckily our state EMS association really stepped up to help us, and they have educated us. They are the ones that have told me, oh Darlene, it's not just one disease. It's not just 5 diseases. It's a variety of chronic illnesses, and it includes people that have trachs, people that have external heart pumps, because there's different almost brands, I guess, and the way your procedures you use on one are different than the procedures you use on the other brand, for lack of a better term. And they said it's terrible that sometimes they lose people because they don't have the instructions. They were talking about trachs. They said maybe for one type of trach you do ABC, for the other type of trach you do XYZ. So you have to know that. So in 2 years' time, with all of our meetings, we really boiled down to one of the best solutions is really to allow our paramedics and ER doctors to follow those emergency medical orders. So your specialist knows your disease best, and he knows what your best treatment is. And everyone with a rare disease that has an emergency treatment, if it's medication, that doctor's going to know the right dosage in an emergency treatment, or maybe it's more than one medication. Maybe it's a procedure. There's 12 mitochondrial disorders that cause people not to process salt. If they give you a standard saline IV, it will kill them. So the paramedics have to be allowed in that point to deviate from standard protocol, because normally that IV saves your life. For those people, that IV is a death sentence. So the paramedic, one, has to have the instructions. He has to know that these are legitimate instructions. And sometimes in an emergency, maybe it's the person who's affected that's hurt, but maybe it's the parent of a child. A paramedic might think that, oh, they're just overwrought and they don't want us to poke their kid. And maybe in all that confusion and excitement, they can't get the message across clearly that no, seriously, they have a rare disease and you will kill them. So having those emergency medical orders is really just the vital link in giving them the instructions that they need. And it also is their permission, because every paramedic has to have doctor's orders. And then if it's the ER, then you have a physician there. He's going to have the instructions from a fellow doctor, and they're going to have phone number if he does need to call and verify anything. So it's really boiled down to, that's probably the key thing. And then changing the protocol that prohibits the use of patient carried meds just in this situation for rare diseases. No, if I have a bottle of pills in my purse, you should not give those to me because you have no idea what those pills are. But if I have specialty medication that's very rare and still in the package, that's one thing we teach all the families. Leave it in the original packaging and be sure you have the supplies that need to go with it. So for my grandson who has severe hemophilia and his sister who has moderate hemophilia, we have their emergency go bag. It has all the supplies they need. It has emergency medical orders. It has a medical alert symbol on the bag. And so the paramedics know instantly, and by the way, they're hooked to the car seats so that when they pull the car seat, they'll pull the bag with it and know for sure. We've also created emergency alert headrest covers because our paramedics said we need to be alerted. So we've created bright yellow headrest covers to go in that car that nobody can miss. And they have a pocket to hold those emergency medical orders and hold any additional information that you need in there. So we're trying very hard to, one, raise awareness to get the regulations changed, share information that we've learned, assist paramedics with the additional education for special medical needs, and then also educate our families on their role in their protection. So asking for a treatment plan with their local EMS, making sure their doctor gives them emergency medical orders because most specialists don't.